Hey,
Good
morning, morning, right
Gotcha.
on. Good morning, Doc. And I have a feeling you got a great show for us this morning.
Well, there's some good news to be shared. Hard fought again. I'm happy to be back. I just my family just got over Omicron. Actually, we were finally hit after avoiding any previous infection. So my first day back at work today. So I've had a lot of time just kind of sit at home and look at what's happening here in Guam and the rest of the world. So yeah, thanks again for having me.
Yeah, Doc. I mean, do you mind if we ask how the illness went?
Yeah, so I'm 3 times vaccinated. I got my booster, gosh, I don't remember now, 2 or 3 months ago.
Right.
My girls got it first. They brought it home from daycare. There were a bunch of kids at daycare that got it. Just over the course of 2 weeks or so, seems like every day or two there'd be another child that we'd hear about that had it. So first girl came home. She was super high fevers for 2 days. Each girl had a high fever for about 2 days. Not as much of the upper respiratory stuff, and they're less than 5, so they haven't been vaccinated. And that's that's very scary when you see temperatures of 104. I mean, you start to get a little worried. But they just over the counter Tylenol, Motrin for the kids, and they got through it. A little bit of persistent upper respiratory infections and upper respiratory symptoms, but my other half and I, there's only so much you can do as parents know when you've got sick kids in the house. You just can't isolate. But my other half is 8 months pregnant, so we're extremely concerned for her. We tried to let her isolate, if anything, away from the rest of the family. And if the kids needed something, I would be the one to help them out. So, but she ended up getting symptoms before I did, about 2 days after our second child, and mostly upper respiratory. And then I followed after my other half by about 2 days. And I think mine were probably the mildest of the 4 of us. So for me, it was just 2 days of a little bit of a scratchy throat, a bit of a cough, dry cough mostly, and congestion. For me, congestion was the worst part. So I have to say I'm very, very happy. But, we had a Super Bowl weekend. We canceled plans. I made sure my parents didn't come close to us as soon as the first girl was diagnosed. So, of course, I had to, take time off of clinic, and that's, a week of clinic for me is, 100 patients we have to call. It's a tremendous burden on not just my staff. Our staff has also been decimated like other workplaces too, but also, it's a big hassle for the patients to have to reschedule as well, and to find spots for all those people is very difficult. So,
yeah, Doc, okay, yeah. Well, I'm sorry. Can I just ask, because given your training and your profession, right? You look at when people get ill, and you go through the mechanics, and why the body is responding to like a certain way, and when someone's getting a fever, you're like, okay, I know as a physician, it's probably X number of hours until it starts to subside and everything like that. So you've got that like reassurance, but you're also a dad, and when you see like young people going through, are there any words of wisdom you can pass on to like people who might be watching right now when you are isolated and like young people that you love and everything are going through something? Like, how do you deal with that?
Yeah. It's hard not to hard not to have a tremendous amount of anxiety. I mean, thankfully, and I guess the number one point is that children generally do very well, and that you have to remember that, and hopefully that gives a lot of people some peace of mind. But at the same time, you don't want to wait too long. And make sure you're reaching out to your pediatrician if something is going on that you just don't feel is right. I think a parent's intuition about what they see as happening to their child is very important. And if they just feel like there's something going on that's not normal, there's nothing wrong. And highly encourage, reach out and tell your pediatrician what's going on. But kids do very well. Very few of them suffer. Very few of them have to be hospitalized, but it does happen. Mm-hmm. And, again, even just seeing the high fevers made me nervous. But if I had to bring my child to the hospital, if my child had to be admitted, the anxiety and fear with that must be tremendous, and even though it's rare, some kids do die, and it's extremely sad. And I definitely, it went through my mind. I wish my children had the opportunity to be vaccinated by this point. I think it would have given me a little bit more peace of mind, and it probably would have mitigated their symptoms a little bit. So, my oldest is going to be 5, and so she'll be due for the vaccine this summer. And I'm definitely planning on giving her that vaccine when she turns 5. There is really good data that shows that even with prior infection, just a single dose of the vaccine will reduce your chances of getting another reinfection by about 50%. So, that's worth it to me, and I think that the safety data is there after millions and millions of the shots been given, even into the pediatric age. It's definitely safe. So I look forward to that. And again, I wish we'd had that opportunity already. But again, thankfully, my kids did all right, as do most kids.
Doc, was this your first round with the virus, or did you catch it previously?
Yeah, this is our first time. No alpha, delta. This was our first go with it. We've done a pretty good job in the office. When we're in a surge, I usually do try to double mask with an N95, and so I think we've taken a lot of good precautions in our workplace. 100% of our staff are vaccinated, and that's just not mandatory. Just been with that can be a little encouraging, I guess, but
can you?
With data, I show the data, and they make their own decision. But I like to think that's protected us. But this Omicron is just a different beast. I mean, as you can see, people get sick with Omicron, even with vaccination, even with booster shots. But it doesn't mean that it's not working, that the vaccine's not working for us.
I had a good friend who's boosted, same as I am, and she I think it was the second time she got it, and her words were, it's not mild. I mean, she didn't go to the hospital, but she was out of it for a few days. Yeah, so it's like you never know. It's it's almost like Russian roulette, right? You just don't know which of the COVIDs you're gonna get.
And we had that moment where my other half had some symptoms, and I'm like, oh, do we have a pulse oximeter here? And we didn't have one, And so, but they have them for fairly inexpensively now everywhere. So we were able to go pick up one of those just to be on the safe side. But those are the little things, get the pulse ox if you have someone elderly, especially someone with comorbidities. Make sure again, they may be desaturating their oxygen levels and they don't really feel it yet. So that kind of information is good to know. We're still getting DOAs, which is just incredible.
I can't even
mind-boggling that we still see that.
Yeah, and especially at the rate that we're seeing it. I know that some of the deaths that were reported since the beginning of the year, some of them were kind of retro, right, where they're from 2021. But when I saw 7 deaths, and they were all from this month, reported out of GRMC, man, it's just heartbreaking, Doc, that we had a whole CDC team come out here and study this, and they came and went and presented their findings, and yet we're still having this awful conversation about it. That's terrible. It is what it is. I know you have a slideshow for us, Doc, so we'll go ahead and turn it over to you, and then any questions we'll do after. So, again, Dr. Peter Lombard, crunching COVID statistics right here on the link. Good morning, Doc.
All right, good morning. Yeah, so here's what the United States looks like, U.S. states and territories, and I don't know if you can see the outlier here. One of these is not like the others. Guam is there was a bit of a delay of about 2 weeks before the Omicron wave hit for us. I initially thought that was a good sign. Maybe it was because we had a more severe, more recent Delta wave, but that certainly turned out not to be the case. One of my earlier maybe predictions, if you want to call it, we wouldn't have as severe of an Omicron wave, but that flew out the window. It was pretty apparent to see that after 2 or 3 weeks. And we reached, cases per capita, so, sort of normalizes all this. The heights that we reached in cases per capita rivaled that of anywhere else in the U.S. And what's really unique about Guam is the duration of our Omicron wave. I mean, it's lasting 1 to 2 weeks longer already than most of the waves for the rest of the states. And I think if anybody's follows me on Twitter, I made a post about this. I think we've got the reason. It was very interesting. A JIC report came out last week that looked at the type of the variants that we have in Guam, and from a sample in the latter week of January, we had a BA.2 variant identified, and 8 out of 10 of them were BA.2, and I think that's huge, and that's where a lot of our discussion is going to be today. So Omicron, original Omicron, BA.1, there's a sort of a child of that, BA.1.1, and then there's this BA.2 variant, which is more of a sibling, and it's even more contagious than Omicron, which is just outrageous. I mean, Omicron already is super contagious, and BA.2 is even more contagious. if you look in, here's South Africa, BA.2 is in orange here, which started to show itself at the end of November. And BA.1, original Omicron, is blue. So blue, they had already been, completely overtaken by the original Omicron. And here comes the BA.2 variant, and it just takes over the course of about a month and a half. And we're starting to see this in Europe as well. And but it's actually not that prevalent in the United States yet. I mean, in most states, it's still less than 5% of all of most of their 95% is still the original BA.1 Omicron. So to see that on the JIG report, very few times I've been super shocked by something, but my eyes just got real wide, and I said, "Oh my goodness!" Well, this helps to explain things, why things are a bit more severe here in Guam, because we're pretty much. I mean, not as the end of January. Now we're mid-February. I wouldn't be surprised if we're 95% or more of the BA.2 variant in Guam. Again, here's the U.S. data. At least the last time the CDC updated it from about almost a week ago now. So orange is the original. Orange is the original Delta. Okay, you can see the purple is the Omicron lineages, and then this little lavender or pinkish color up here is the BA.2. So nationwide in the United States, it's still a very small percentage of total, and it's extreme. It's actually quite different from BA.1, the original Omicron variant. It's got 23 unique amino acid changes, mutations. Here's the BA.2 that makes it part of the BA.2 that makes it unique. These things are what's conferring its increased transmissibility. And then I did a little research, and I was why do we have BA.2 here where it's not really prevalent in the rest of the United States? And I think the answer is pretty apparent when you look at the yellow line here. That's the Philippines. They are already, as of early January, well over 90%. BA.2 as well. So I think given the travel that we have, even though it's not as much as it used to be, I think the writing's on the wall there for how Guam came to have BA.2 as prevalent before the rest of the United States, whereas we've previously sort of been delayed by a few weeks for what's been going on in the U.S. Singapore is up also with BA.2, and also Hong Kong is another one that I saw. So here is that JIG report that showed from samples on the 25th and 26th, and it was not only surprising to see this at all, but it was surprising that we got one that was so recent. I don't know if you guys, when we see these genomic analysis, oftentimes they're a month or two old, and you're like, okay, well, that doesn't really help us. We kind of assumed that was the case anyways. So to see this only being a couple weeks old, I think was really interesting, and then again, really helps to explain why we're in this prolonged wave. And I think, again, the caveat being, what's the next variant going to be and how soon is it going to get here? But, in the absence of anything new showing up, I mean, now we're in good shape. I mean, we're on the decline. I mean, you can see it from the cases. I think even the hospitalizations, you can see it already. We're in the decline from this wave, whereas the rest of the United States may end up seeing sort of a double hump here. Omicron original, and then the BA.2 may start to cause another hump, another surge. Maybe not as bad, but I think that once this surge comes down, we're gonna be in good shape for a while until the great unknown. What is this crazy coronavirus going to do to us next?
Yeah, Doc. Sorry to get in here just real quick. It was interesting that when the BA.2 announcement came out in the JIC, they kind of buried the lead a little bit, huh? It was like way down there.
What? Sorry?
They buried the lead a little bit. It was kind of way down in the report.
Yeah, I don't know. I mean, to me, this is
huge.
Big news. I mean, I think it says a lot, it explains a lot, and it's very unique about. Well, I mean, you read these things, you look for things that are different, unique, and this is something that definitely jumped out at me. And I think they did talk about it at the last press briefing, but I think for a lot of people that are need to put into context what's happening here, scratching their head about why are things different in Guam? Why are we still in this big wave? I definitely think this helps to explain things more than a lot of other possibilities. Because this is definitely a very, very long and pretty severe Omicron wave that we have in Guam for a place which is extremely well vaccinated and where for the most part in public places, people are masking very well. We've talked about that before. I think Guam, compared to a lot of other cities in the U.S., I mean, we do a really nice job, and our vaccination numbers are fantastic. And so, to try to reconcile that with why are we struggling with a very severe Omicron wave, shouldn't it have been much less? Well, maybe this BA.2 thing helps to explain that.
Right. I saw your next slide. Was that about the right? I saw this. So, okay, we'll get back into it. Dr. Lombard is now going to address whether or not the BA.2 variant, whether or not monoclonal antibody treatments are effective against the BA.2 variant, Doc.
Yeah, this just came out a couple days ago. Unfortunately, some of the early data were showing is showing that the monoclonal treatment is not very effective against BA.2. So that's definitely not good news. And I don't know how many of our hospitalizations or deaths had progressed after receiving monoclonal antibodies. It would be interesting to see that kind of data, as well as data on whether or not, or how many of these deaths were people that were boosted. A nice summary slide of that would be nice. The good news is, though, that the vaccination effectiveness against symptomatic disease, so that's any infection, any symptomatic infection, it actually is holding up well, whether you're talking about BA.1 or BA.2. So if you've had 2 shots, 3 shots, and this is 3 shots and over 2 months beyond your 3 shots, it's still 50% effectiveness against symptomatic infection with the original Omicron, and it doesn't drop a whole lot with BA.2. So that's the good news. The vaccine is still helping to prevent infection. It doesn't stop infection, it doesn't stop transmissibility, but it does decrease it. So many people want to be all or nothing. Well, vaccine doesn't stop infection and transmission. No, it doesn't. And we're going to be honest about that, but it does decrease it. And I think that's important. We have to, line up as many mitigation things as we can to help prevent the virus from reaching somebody where it does cause more severe morbidity. Here's what our hospitalizations look like. We had a peak a few days ago. Now we're back under that 50 range number, and I would really like to think that this number is going to go down as our cases have started dropping as well. The deaths in Guam, so again, I wish I had access to a little bit more data with regards to boosters, especially in this group. But, we've had, prior to Omicron, we had about 270 deaths. This is before January 1st. And that would give us a case fatality rate of about 1.4%. About 15 people out of every 1,000 that tested positive died. Okay. Now, and that was before Omicron. Now we've had 45 deaths since January 1st, and that's a lot. Out of all of the deaths, 315, it represents 14% of all the deaths that we've had in Guam from COVID. So 14% of all COVID deaths have come in the Omicron wave. And our case fatality rate, because we have so many more infections that are diagnosed with a positive test, it drives down the case fatality rate. So now only 2 out of every 1,000 positive tests are dying of COVID. Okay, so that's good. And that really speaks to a few things. One is the effectiveness of vaccination, but also the fact that it is true that Omicron is less severe. If you compare apples to apples, Delta versus Omicron, it's not going to be as severe as Delta. And it also speaks to the fact that, Omicron is so darn transmissible that there's just so many people that have it. So, it is true that Omicron is less severe, but it doesn't even matter when you have so many people getting infected, you're still going to have quite a few deaths. So the number of deaths we've had per week since January 1st has been, on average, close to 9 to 10 people are dying every week since January on average. And that's pretty close to as high as we ever were in Delta. So and even in the original surge, where we had quite a few deaths in the original surge with that one before, we had widespread vaccination. So I think, again, the rate of deaths that we're seeing per week is pretty similar, despite the fact that Omicron is less severe, and that's because so many more people are getting infected. So since January 1st, we've had over 21,000 diagnosed cases, and you guys know there's a lot more out there that we're not diagnosing. And so that represents over 50% of all the diagnosed cases that we've had. So just in 6 weeks, we've diagnosed over half the cases that we have ever since this pandemic started, which is a pretty remarkable stat. And I think that's not just due to transmissibility, but it's also, we have, of course, much better testing capacity now. But again, if you estimate if perhaps we're we're only picking up, 20% of all the actual cases out there. Is it possible we've actually been over 100,000 people in Guam that have been infected by this Omicron wave? I don't think that's a stretch, maybe not that high, but it still, again, shows you how rapidly and how much of Guam has been affected by this. So I do wish we had more information about how many of these deaths have been boosted. I think lately in the JIC reports, they've been starting to indicate if they've been boosted.
There was one.
And maybe that means that before any deaths, I think the last group of 7, I think one of them was boosted. Maybe that's the first one that has passed away that has been boosted. So it would be really nice to see that. I do want to say it's not unusual for us to see, whether you're looking at the hospitalizations or deaths. I think in absolute numbers, you're going to see 2 times the number of people that are vaccinated than unvaccinated. I think that speaks to just how many people we have vaccinated now versus unvaccinated. Here's just a quick death chart, death curve for us. This was the Delta wave, so we haven't quite reached the peaks that we saw with Delta, but we're still seeing, as I mentioned, about 10 deaths per week on average. A quick mention again about the base rate fallacy, and this speaks to the 2 times absolute numbers. Okay,
so Doc, before we get into this, basically what you're explaining here is this mentality, kind of the all or nothing, where, if you get the vaccine, what's the point? You could still die. You could still end up in the hospital. And so you're addressing that train of thought in this slide. Okay, thank you.
It's very easy to look at the numbers and say, hey, look in the hospital, there's 2 times as many vaccinated as unvaccinated, and I can understand why that looks like it's something that's hey, got you, that proves that the vaccine doesn't work. It doesn't at all, and I think it's intellectually dishonest to say that, whether you're talking about deaths or hospitalizations, because you're going to see the same thing in both cases. I think you're going to always, from now on, because we have so many people vaccinated, you're going to see higher absolute number of people that are vaccinated in the hospital and dying than you are unvaccinated. And this, I think this little diagram does a great job of explaining this base rate fallacy, where you got to focus on, if you need to focus on the rate, but people focus on the absolute numbers. So if all you did was look in this little circle over here, well, there's 2 times as many vaccinated people in the hospital than unvaccinated. But if you look at the total pool of people vaccinated versus the total pool remaining that are unvaccinated, you can see that the rate, or the number of people over the denominator, the total people, that rate is much, much less for the vaccinated group. And I think that based on the rates that they're publishing in the JIC report, that rate can be anywhere from 6 to 10 times less in the vaccinated population than unvaccinated. So I think that always needs to be put into context. But I think also, to be intellectually honest, we also need to acknowledge and not shy away from the fact that, people that are vaccinated are going to die, and we're seeing it, and I don't think we don't want to highlight that, but I think we need to acknowledge that it's happening, because there's just so many people that are sick, and some of them are going to die even though they have been vaccinated, because it's not 100% effective vaccine against death. It's 90% when you first get it, and then it wanes over time. So if you're 6 months to a year after your just 2 doses, what has that efficacy waned to protect you against hospitalization and death? I mean, it might be 60, 70%. So again, get that booster shot, because it's going to bump you right back up to that 90% protection again. But I think it does bring up a good question, with regards to restrictions on, especially on the unvaccinated.
Oh, I wish I had a drum roll for this.
I mean, I think, the unvaccinated proportion of our population in Guam is extremely small. Yeah. And when you think about, most of them have already been infected, probably, I wouldn't doubt 80, 90% or more of them have already been infected. I think that there's very little utility at this point of continuing to push restrictions on unvaccinated people that are different. Now, but that's very, that's very local. That wouldn't hold true in a place where they don't have as highly vaccinated
like
population.
The States, right, Doc, or where their vaccination rate is nowhere near ours. But
exactly. Or if locally you're in the middle of a big surge, or if locally your hospitals are sort of at the brink. I mean, all of those things sort of matter. But based on where we are now and how many people that are remaining unvaccinated, which is a little bit confusing to me. I'm going to talk about that in a second. But before I do, there was a randomized controlled trial that just came out as well on this Paxlovid oral agent, which I don't think we have a lot of, but we do have it. This was over 1,000 people in each arm treated with either the medicine or not the medicine. And when you look at hospitalizations in the treated group, only 8 of them were hospitalized versus 65 in the untreated group with the placebo, which is 89% efficacy, which is fantastic. And there were no deaths in the treated group. So this is a wonderful, this next to the vaccines, this is just a fantastic treatment option we have. Unfortunately, there's a lot of restrictions, and as you guys probably heard, there's many conditions and many reasons why we can't give this to some people. Interestingly, in this trial, everybody wasn't vaccinated. So, we can't really say for sure. We don't have the data yet to say how protective is it against vaccinated. But I think just you can extrapolate. It probably still works pretty darn well. And they also excluded people that had prior infection and people that were already so severe that looked like they were going to be admitted within a day or two. So these are really people who they had the benefit, at least for us now, how to get this medicine. If you get diagnosed, hopefully your primary care provider knows the pathway to get you this medicine. If you've got a lot of comorbidities, you've got early symptoms, they're not severe yet, this is the ideal person to get the treatment, because we don't have a lot of it right now as far as I know.
I just wanted to buzz. What if you don't have a primary care doctor? Are you familiar with the process?
If you don't have one, there's a lot of clinics to call and try to get one. Or there's urgent cares which you can go to, which I think the doctors in urgent cares are going to be pretty familiar with what to do with you if you may be a candidate for this. And then the ERs, if your symptoms are severe enough. I think a lot of people treat ERs like urgent cares anyways. But everybody should have a primary care doctor. It's nice to have, even if they've got a huge panel of patients. It's hard for them to remember everybody, but just one visit with them at least establishes a baseline and gives them a little bit of rapport with you, and will help them to remember who you are the next time you come in. So always promoting people to maintain a good primary care doctor.
Thank you, Doc.
I wanted to touch on this briefly. There's there seems to be a lot of sentiment that nobody wants mandatory masking in schools or in public places. And it's quite contrary to what the data actually shows. If you poll people and you ask them, would you support, requiring face masks in certain situations? It's pretty overwhelmingly in favor of face masks. And I think
man,
it's that rugged individualism out there, I guess.
I saw you tweet that, Doc. That was funny.
They think that they think the potatoes cure COVID or what?
Well, at best, it's 50-50, but in most places it's 60, 70, even up to 80% in some places. So it's very contrary to the notion that nobody wants mask mandates. I think most people would be in favor of them in the right settings. And it's really hard to reconcile this with what I feel like I'm hearing on social media and the types of voices that come out and rail against any sort of mitigation measures at all.
Doc, if you got 10 people and 8 of them are okay with wearing a mask, but then the 2 who aren't are yelling really loud, it's kind of hard to ignore those voices, right?
That's who you hear. So, if you support mask use in the right settings, you're in the majority, and don't feel bad about it, basically. I wanted to talk about rapid tests a little bit too before we wrap things up. I know there's some doctors out there perhaps that I think it's appropriate to take these with caution. I think the most important thing about rapid tests is it tells you if you're infectious right now, okay? And that's about the best you can say. Am I infectious at this moment? Okay, so a negative test actually isn't that helpful if you're having symptoms, because it's everywhere. Your symptoms, if they're classic for coronavirus, is probably COVID. And that means if you're negative today, you got to retest it with another rapid test, which if they're cheap and they're easily accessible, that's easy and it's wonderful. And that's such a great thing for us to be able to do. this is a doctor, Dr. Mina. He's been really pushing rapid tests since the beginning of the pandemic, and it's just incredible. It's taken 2 years before we're finally at a point where we're starting to see them more accessible. I mean, if everybody had 10 rapid tests at home at the beginning of Omicron, I really think that would have made a big difference in terms of identifying people that are sick faster, and then it's also useful for coming out of isolation as well. I don't think public health is allowing these tests to be used as official counts or as a negative test at the end of your isolation to be able to let you get out of isolation. But I think it's more reassuring, I think, to have a negative COVID test when you're finishing up your infection than it is to just put an arbitrary number on it and say 5 days if you feel okay. And I'm sort of a case in point there, because I started having symptoms on a Friday. At the 5-day mark, I'd say, yeah, I feel pretty much back to normal. I want to go back to work, but I did a rapid test and I was still positive. It was faintly positive, but it was still positive. So I stayed home for another day, and I tested the next day and I was still just a little bit positive. So I think, there's a lot of value there. So I stayed home an extra 2 days over beyond what, the guidelines would have allowed me to do because of the rapid tests. And I think that this is one area where this could be extremely useful. So this doctor, what he did, he was 2 times vaccinated. He didn't have the booster, but he got COVID. He started testing himself because he's such a prominent voice on rapid tests, he gets all these free samples. So he had all these different rapid tests. These are all different brands, and he just tested them with every single one of them just to see how they performed. And so you can see, most of them were very positive on the first day of symptoms, but interestingly, a couple of them were not positive on the first day of symptoms. So again, I think that there's people out there who are negative on an antigen test. Don't say, woo, I'm good to go. If you've got symptoms, get tested again the next day. Either go to a testing site or get another rapid test and keep testing yourself. But it also showed for somebody that was not boosted, it took him 10 days from the first day of symptoms before he was negative on all the tests. Now, some of them started to show negative on day 7. And maybe that's light enough of a viral load that he would not be very infectious even if he did leave isolation. But I think this was a kind of instructive to hopefully to everybody that there is a place for antigen tests that can be used in the right setting. Don't take a negative test as gospel that you're negative if you're testing yourself early in the course of your symptoms. But I would say, if you've got upper respiratory symptoms and you do that and they're pretty severe, you test yourself 3 days in a row, you've got no known COVID contests and it's negative every time, you'd be pretty hard pressed to say that you actually have COVID, I think. Now I know that's probably not going to be anything that you can hang your hat on, especially from public health's point of view, but right. But I'd say that's reasonable data. I'd feel pretty good about that rather than not having any data at all, at least. So test again if you're still symptomatic, and if you're infectious, stay home. If the test is positive, you have enough virus in your nose that you're infectious, and that's number one. So don't take a negative test as gospel that you're negative.
Doc, okay, yeah. Go ahead.
I'm sorry?
Go ahead with your take-home points, Doc. Sorry.
Oh, well, I think we're getting close to 80-90% vaccinated, and at least, but with 2 times, and only about 40% of our vaccinated are boosted. This is a little the place that has me scratching my head a little bit. I'm not sure if we talked about this. So the JIC report says we've got about 7,400 unvaccinated people in Guam. Okay, and that's excluding the 12,000 or so that are 0 to 4 and ineligible. Okay, the JIC report also says we've got 5,000 vaccinated 5 to 11-year-olds. Well, how many total 5 to 11-year-olds do we have? So that's 6 years worth of kids. And if we have 12,000 kids age 0 to 4, 5 years worth of kids, we've got to have at least 12,000, I would think, kids in this age range of 5 to 11. And if 5,000 of them are vaccinated, that would have to leave at least 6,000 of them unvaxxed, right? And if we only have 74,000 total unvaxxed over 11 years old, then that only leaves 1,000 to 2,000 people unvaccinated over 11 years old in Guam. I mean, that's just, it just doesn't make sense to me. But if that's true, and maybe it is, if that's true, again, and a great proportion of these have probably already been infected. I do think that that should help guide policy with regards to what we're doing. But it also helps put into context the fact that, we are seeing more vaccinated than unvaccinated hospitalization and deaths, but that's because we have hardly any unvaccinated people left in Guam at all. And of them, a pretty big chunk of them are pediatric age, which tend to do pretty well. So just to drive this home, vaccination does reduce infection, not 100%, maybe not as much as we'd like, but it definitely reduces severe disease a lot, even against Omicron and even against the BA.2 variant. I think rapid tests can and should be used as a marker of contagiousness. As far as the surge goes in Guam, what to expect over the next month, this has been a long 6-week surge. We have more or less, actually, this was my prediction, I think, before, 6-week surge, hospitalizations under 60 and peak cases in this range. So I think we did achieve that. But the BA.2 did prolong this wave, and I would like to think it will prevent another little surge in the future, which we may end up seeing in the United States. Denmark is a place to follow. They've got their BA.2 proportion is growing, and they've sort of said we're done with COVID. They stopped all restrictions, and their case counts and deaths are increasing. So it's an interesting place to follow if you're interested. But I do think since we're only on the down curve and we still have quite another few weeks to go as we come down from this, I do think that 20 to 30 more deaths are possible as we come down from this Omicron wave, which is tragic and hard to hear, but that may be what we're in for still.
Well, Doc, we've been having you on for a couple of years now, and I hate to say it, but the one thing that you've been pretty accurate about with your predictions is the number of deaths that we can anticipate in these surges. So.
Well, I do hope I'm wrong here.
Right. Me too.
The deaths definitely are delayed by 2 or 3 weeks from where our peaks are in cases. So hopefully the messaging is getting out there to more people, and there are still people getting vaccinated and boosted every day, and that's going to be protective. And now that a lot of us have been exposed to Omicron and we're vaccinated again, that hybrid immunity is going to serve us well in the future.
Thank you, Doc, so much for your time, and enjoy your first day back at the office.
Awesome. Thanks so much. Take care, guys.
There you go, Dr. Peter Lombard. Always a great presentation there. A whole lot of takeaways, and we cut these interviews up and we throw them on our YouTube, right, Jay?
We do, yeah. So if you're watching live right now, if you're watching on YouTube, one of the cool things about YouTube is you can actually scroll back while we're live. So if you missed anything that the doctor said, or you want to actually hear what he said again to let it really, really sink in, some really good points that he made especially about young people, the predictions he was making about projections, I should say, about the amount of our younger demographic here on Guam who may not be vaccinated.
Right.
You probably want to watch that again. Let that one sink in.
We're going to take a real quick break, and then we're hopping on a plane and flying over to the CNMI for their weekly press conference with Governor Ralph Torres. We will be joined by Tomas Maglotny of the KUAM News.